Hi, everyone. I'm Reeba, and I'm here today with my daughters, Myla and Ava. Today, we want to share Myla's journey with you. No one is ever prepared to hear that their child has a brain tumor. The news is confusing and terrifying, and you have so many questions. You just don't know what the future will hold. But I can tell you from experience that with a medical team that you trust and the help of family and friends and asking a lot of questions, you and your child will find a way through a diagnosis of pediatric low-grade glioma. I'd like to introduce two key members of the team who took amazing care of Myla, Bridget and Dr. Landy.
Hi, I'm Bridget Archambault, and I work at Duke Cancer Center along with 4 pediatric neuro-oncologists. As the sole nurse practitioner with the program, I have become the primary person providing continuity of care for all the patients who are on targeted therapies. I got to know Reba and Myla in 2016 when Myla was receiving chemotherapy, and we've been very close since then because I see a lot of the patients when they come in for routine treatment and imaging.
Hello, I'm Dr. Daniel Landy, one of the pediatric neuro-oncologists with the Preston Robert Tisch Brain Tumor Center at Duke in Durham, North Carolina. I joined Duke in 2017 and soon joined the team taking care of Myla. And Myla and her mom and dad have really welcomed us into our family. Reba, why don't you tell us a little bit about Myla and her PLGG journey?
Sure, thank you, Dr. Landy. Everyone has been so dedicated to Myla and helping us through this journey. It all started with her checkup when she was actually 15 months old. Myla was born on December 22nd, 2012, and I was a first-time mom, so I made sure that she saw the pediatrician regularly. I went to every scheduled visit as I was supposed to. She was growing. She was really bright. Her hand-eye coordination was great. The only thing that the doctor kind of pointed out to us was that her head was big for her age. We also knew that at that point, at 1 year old, she still wasn't walking yet, which was a concern. She was adopted, but we kind of joked anyway that she got her father's head because her dad has a really large head. At her 12-month appointment, the pediatrician put Myla on physical therapy simply because some kids just need a little help getting started walking, and we thought that's all it was. She hated PT. She would just lie there and cry and not do the exercises. But then at her 15-month appointment, her head had grown so much that the doctor told us that we needed to immediately go get a CT scan. I didn't even know what a CT scan was at that point. After the scan, they told us she had hydrocephalus, again, a word I had never heard before. We eventually ended up in the ER, and they did an MRI. At that time, I was 8 months pregnant with Ava, and the doctor kept telling me to stay calm. He didn't want me going into labor when he delivered the news that he needed to give us. I'm typically a really kind person, but in that moment, I probably wasn't very kind. I probably used some expletives. I just wanted him to tell me what was happening. I was so confused, and I didn't understand it. I'll never forget the words he said to me when he said, "Your very tiny daughter has a very large brain tumor, and we're going to need to operate immediately." I got to tell you, I couldn't really believe or really understand what I was hearing. You know, in our minds, Myla just couldn't walk. I mean, that was all that was wrong with her right at that point. And we didn't really get it. But when the surgeon said that this was serious, and then when he told us, "Hey, you guys need to call your families. Everyone needs to come in," I think that's when it really sank in. We both have amazing families. They all came. And I remember just before the surgery, I went to the surgeon and I asked him if he had had a good night's sleep. And I asked him if he had fought with his wife because I just wanted to make sure he was in a really good frame of mind before he operated on Myla. And of course he was. He did an amazing job. He removed almost all of the tumor and he inserted a shunt to drain the fluid around her brain. And after that, there was just so much to learn about this tumor.
Thank you for sharing that, Reba. It's an incredible story, and I've heard and been a part of this story. I would add that, pediatric low-grade glioma, the type of tumor that Myla has, is the most common type of brain tumor that we see in our children. It's the most common central nervous system tumor in kids. And sometimes these tumors can be removed surgically, but oftentimes they can't due to the location. Unfortunately, about half of patients see their tumors get worse after the first treatment. Bridget, what kinds of symptoms have you seen in our patients who are diagnosed with pediatric low-grade glioma?
Yeah, kids and teens with PLGG often have problems with their vision, movement, thinking, and daily activities, depending on where the tumor is located. Each treatment, including surgery, can increase the risk of long-term issues. Myla's tumor is in a place where it didn't affect her speech or vision, but it blocked the flow of the fluid around her brain. That pressure could have eventually caused problems as well. Reba, tell us what happened after Myla's first surgery.
Yeah, so 3 months later, about a week after I'd given birth to Ava, we brought Myla in for her 3-month checkup. She was doing so well. She was happy. She wasn't upset about PT anymore. She was doing all the exercises. So we actually were planning on celebrating by going to get her new shoes because we knew everything was great. We were going to get a great checkup. But instead, we were devastated to hear the news. The tumor grew back fast and large. She needed another surgery, and she was going to have to start chemotherapy. Starting chemo was really hard, shuttling back and forth between the hospital, trying to breastfeed, caring for my newborn Ava, and still trying to spend enough time with Myla, right? It was just a tough time. Luckily, Myla really loved her Duke days, as she called them. She loved the nurses. The doctors would come in and joke with her, but she did experience some side effects, including an allergic reaction to one of her treatments. That happened, luckily, when we were at the hospital, and thankfully her treatment team jumped in right away.
Yeah, Myla had a few other treatment options, including chemotherapy, radiation, and limited choices of targeted therapy to choose from given the BRAF gene that found in her tumor. However, radiation was not desirable because of her age. Most options available to treat PLGG, including chemotherapies and certain targeted therapies, are only approved by the FDA for use in adults. While surgery, chemotherapy, radiation, and targeted therapies may be effective treatment options, it is important to know that they can also have lifelong impact on a child's quality of life. Some treatments may need to be taken once or twice a day, or even require a child to go to a treatment center to be administered. Do you remember some of our discussions about Myla's treatments?
Yeah, absolutely. Her treatment plan was changed a couple of times, right? And every time it was, I had the same questions, right? What are the side effects going to be? How long will she be on it? And how often will she need to take it? And do we need to come to the hospital for those doses? Myla would throw up a lot, especially if she got really, really hot. I tried to have sick bags with me all the time, and I still have some in the backpacks that I carry just out of habit. Getting her to the treatment center was another really big commitment, right? That's where we had to go for her doses at that time. My ex-husband and I were both working, and so we would swap kind of taking Myla. And then in 2018, Dr. Landy suggested another possible option.
Right, so in 2018, Myla's tumor had progressed again, and we needed a new approach. So we offered another targeted therapy available at that time. Targeted therapies can target and attack tumor cells with specific characteristics. At that point, Myla could swallow pills, so this medication was an option. But after a year and a half on that treatment in 2021, we had to tell Reeba that Myla's tumor had grown again.
Yeah, hearing that, my mind just raced. It was so hard to listen to what you guys were saying. The news came at a really tough time, too. I had just started a new job, and my husband and I were both were going through a divorce. So I remember asking you guys what the options were, right? I figured the only option was going to be chemotherapy. And that's when you, Dr. Landy, told me about a clinical trial of a targeted drug designed for children, which is incredible. It was terrifying to think that Myla would be patient number 30 on this completely new drug. It was early in the trial, and nobody really knew what to expect at that point. You did tell me about the side effects that were already known and that it was a 2-year trial, so I could kind of wrap my head around knowing that treatment would stop sometime in June 2023. We also knew that Myla could swallow pills, and this was an oral drug taken once weekly. That was a huge relief to us because there were no more weekly trips to the hospital, as much as we loved seeing you all. We have so much trust in this team, and so we agreed to have her go on the study. Bridget, you can probably say more about why this trial was a good fit for Myla.
Yeah. Myla was a good candidate for this study for several reasons, including the type of tumor she had. Her tumor showed an alteration in a specific gene called BRAF, which causes cells to grow into tumors. The majority of patients with pediatric low-grade glioma have a BRAF alteration in their tumor. The drug being tested, tovorafenib, was designed to specifically target BRAF alterations in pediatric low-grade glioma.
That's right. And so tovorafenib was studied in the trial called Firefly-1, and tovorafenib went on to be approved by the FDA and is now called OJEMDA.
What is OJEMDA, tovorafenib? OJEMDA is a prescription medicine used to treat certain types of brain tumors, cancers, called gliomas, in people 6 months and older. That is a pediatric low-grade glioma, LGG, and that has come back after previous treatment or has not responded to previous treatment, and that has a certain type of abnormal BRAF gene.
OJEMDA is available in tablet or now liquid form.
Based on the study evaluation, 53% of the 76 children who participated in the trial saw their tumors shrink by at least 25%.
Children on the study had an MRI every 3 months.
And during the first MRI at 3 months, 45% of children saw tumor shrinkage. During the second MRI at 6 months, 75% of children saw their tumors shrink.
Now, we saw Myla's tumor shrink at the very next MRI, right after we started. Not everyone in the clinical trial had the same results, but Myla's tumor shrank and it stayed stable, which is amazing. After she finished 2 years on OJEMDA, our team suggested that we stop therapy. That was last June, and since then, the tumor has not grown at all. While she was on OJEMDA, though, we did need to turn to the care team to help with some side effects.
What are the possible side effects of OJEMDA? OJEMDA may cause serious side effects, including bleeding problems, hemorrhage, skin reactions, including sensitivity to sunlight, photosensitivity, liver problems, slowed growth in children. The most common side effects of OJEMDA include rash, hair color changes, feeling tired, viral infection, vomiting, headache, fever, dry skin, constipation, nausea, acne, upper respiratory tract infection.
Reeba, tell us how Myla did with the side effects.
So Myla's hair did turn completely white, and everywhere we went, people commented on it. They would always either compliment it or they would ask her, "Did your mom let you dye your hair like that?" She also, though, did have some pretty severe skin reactions, and we did have to learn how to manage some of those.
Yeah. Your family was actually one of the first families that I introduced bleach baths to for skin rash. Myla said, "You want me to do what to my bath?" But you and Myla were so resilient and open. You went ahead and did it. And you actually came back to me and said it had really helped. In addition, we'd given Myla a topical antibiotic for some of her skin lesions that she'd had. Myla also shared with us what she was feeling and what her body was telling her, which was a big thing in knowing how to treat her.
Additionally, OJEMDA can affect growth, and Myla's growth was impacted while she was taking tovorafenib during the clinical trial.
After Myla stopped taking OJEMDA, we saw improvement in her growth around 3 months, and by about 9 months she was catching back up.
What has being on OJEMDA meant for you and Myla?
Myla's entire life has been about getting treatments and seeing doctors, but she understands that by being on this trial, she helped contribute to something really, really important. I said to her, "You made history," right? You were literally making history by being on this trial. It went to the FDA, it got approved. There are now other kids who are going to be able to take this now.
Yeah, Reeba, you and Myla have experienced so much and come so far. What would you say to other families going through the same thing?
You know, I guess to start, the best advice I got came from my cousin. She's a pediatrician, and her child also had some medical issues when he was a baby. And she told me that I need to be Myla's advocate. Nobody will know Myla as well as I do, and I should never hesitate to ask questions and protect Myla. For example, I know it's a teaching hospital, but I also say it's my daughter, right? So what I tell people is you get 2 chances to give her an IV. If you can't get it in, then we either go find someone else to do it or just go get the ultrasound machine, right? And you can do that respectfully, but being that advocate for your child and realizing that you know your child better than anyone else at that hospital because you're with them day in and out, day out, that is so important. And that was probably the biggest piece of advice I got. Also, do research to find a care team that you trust. You need to be able to trust in their advice and their recommendations. And then I would tell you, ask the questions of everybody all the time, because everybody has a different perspective and different types of knowledge that can kind of help you.
Thank you, Reba, for sharing that. Reba's and Myla's willingness to share with others, with other families, and to connect and share their journey has really made a difference. We have an annual fundraiser walk, and Myla was out there with her white hair and her hat and her sun protective clothing, and she noticed another little girl who also had white hair and a hat. And they connected when they realized that they must be on similar treatment and have gotten together since. That's just who Reba and Myla are in this journey, wanting to touch others on a similar journey as well.
Really wonderful that you do share your journey and help others in this way. You're a tough act to follow, and I've heard you talk about Myla and your journey together. I have twin boys, and I think seeing other parents navigate a journey like you and Myla have been on colors my own experience as a parent, where even though my sons don't have a brain tumor, my goal is to always be honest with them, but also to be their advocate. And at the end, I think probably what most of us as parents want is for their children to have intact medical, physical, and emotional well-being. And I think that you and Myla have weathered this journey beautifully, and it's kind of you to share it with us. So OJEMDA has helped shrink Myla's tumor, and I think by and large, OJEMDA has been helpful in managing other patients' tumors.
True. Thank you for helping me share Myla's and my story.
Indication. What is OJEMDA, tovorafenib? OJEMDA is a prescription medicine used to treat certain types of brain tumors, cancers, called gliomas, in people 6 months and older, that is a pediatric low-grade glioma, LGG, and that has come back after previous treatment or has not responded to previous treatment, and that has a certain type of abnormal BRAF gene. Important safety information. Before taking or giving OJEMDA, tell your healthcare provider about all of your or your child's medical conditions, including if you have bleeding, skin, or liver problems, are pregnant or plan to become pregnant. OJEMDA can harm your unborn baby. Females who are able to become pregnant, you should use effective non-hormonal birth control, contraception, during treatment with OJEMDA, and for 28 days after your last dose of OJEMDA. Males with female partners who are able to become pregnant should use effective non-hormonal birth control, contraception, during treatment with OJEMDA and for 2 weeks after your last dose of OJEMDA. Are breastfeeding or plan to breastfeed? Do not breastfeed during treatment and for 2 weeks after your last dose of OJEMDA. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking certain other medicines can affect how OJEMDA works and may increase your risk of side effects. OJEMDA may also affect how other medicines work. What should I avoid while taking OJEMDA? Limit the amount of time you spend in sunlight. OJEMDA can make your skin sensitive to the sun, photosensitivity. Use sun protection measures, such as sunscreen, sunglasses, and wear protective clothes that cover your skin during your treatment with OJEMDA. What are the possible side effects of OJEMDA? OJEMDA may cause serious side effects, including bleeding problems, hemorrhage, are common and can also be serious. Tell your healthcare provider if you develop any signs or symptoms of bleeding, including headache, dizziness or feeling weak, coughing up blood or blood clots, vomiting blood or your vomit looks like coffee grounds, red or black stools that look like tar. Skin reactions, including sensitivity to sunlight, photosensitivity. OJEMDA can cause skin reactions that can become severe. Tell your healthcare provider if you get new or worsening skin reactions, including rash, bumps or tiny papules, acne, peeling, redness or irritation, blisters. Liver problems. Your healthcare provider will do blood tests to check your liver function before and during treatment with OJEMDA. Tell your healthcare provider right away if you develop any of the following symptoms: yellowing of your skin or your eyes, dark or brown, tea-colored urine, nausea or vomiting, loss of appetite, feeling tired, bruising, bleeding, pain in your upper right stomach area. Slowed growth in children. Growth will be checked routinely during treatment with OJEMDA. The most common side effects of OJEMDA include rash, hair color changes, feeling tired, viral infection, vomiting, headache, fever, dry skin, constipation, nausea, acne, upper respiratory tract infection. OJEMDA may cause fertility problems in males and females, which may affect your ability to have children. These are not all the possible side effects of OJEMDA. Call your healthcare provider for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Day One Biopharmaceuticals at 1-877-204-2820. Please see full patient information, including instructions for use, for more information.